You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, good morning. Today we're going to do question and answers. Now I've got a series of questions that came in. This is day 6 or 7 of solitary confinement. Pray for my wife. Got to put up with me. I've been trying to get outside though and getting some fresh air, which is good. Remember, open air therapy. You heard it. You first heard it here. So question number 1, is asking about, after listening to today's podcast, that would have been yesterday's, about the thyroid. She tells me about her free T4, which is good. The doctor checked it and is 10.1 and the TSH 2.50, and I take 90 milligrams of desiccated thyroid. Well, the T4 is low, but Dahlia, thanks for asking the question here. Listen, it's very important to understand this with the thyroid, okay? And almost every other test too, because I always ask the question when people send me in their blood work and all that. Look, numbers are numbers, and they can be good indicators, but they're not perfect indicators. Okay, so let me give you an example. How do they come at these numbers? Well, it's the 95% rule. So 95% of people will fall into these categories. That's normal. 2.5% on the high side, 2.5% on the low side. That's how they come out. That's how they get an average number. The problem with that is some people are in that 2.5% on high, some are 2.5% on low, and numbers are just numbers. And this is why I was trying to explain, I think I did it yesterday, that functional medicine is taking your numbers and your symptoms and marrying the two together, because that's really important. Think about it. How do you feel? Like, you know what? Numbers. So I would ask you, Dahlia, how are you feeling? Go more on that. Don't try and play with numbers because numbers are not everything. Why do I want to get my T4 up if I'm feeling good? Now, if you're not feeling good, that's really more important. I like desiccated thyroid. It's a natural. Armor thyroid is usually, I used to use it. I don't like it as much as I like a complete thyroid formula to level out the thyroid gland, okay? Because there's a lot of things that go into the thyroid. I was telling you yesterday, the hypothalamus is really, it comes from there, but the thyroid is such a sensitive organ, especially in women, because the thyroid is reliant on a woman's ovaries. The thyroid is reliant on a woman's gut. The thyroid is reliant on the woman's adrenals, cortisol. So again, I would just say to you, Dahlia, depending on how you're feeling, I wouldn't up necessarily. Let's say you are a little bit tired. I would look at supporting the thyroid. You know, like your thyroid, for example, doesn't work properly without the right levels of iodine. Iodine is specific to the thyroid gland. So again, depending on how you're feeling, and if you don't mind, Dahlia, if you're watching today, then send to my staff just how you're feeling. And then I can make an adjustment with that. But I wouldn't specifically worry about those numbers. The thyroid is subject to fluctuation, and I've never relied on numbers on the thyroid as much. To some extent, yes, the lab work is important, but it's not everything, especially with the thyroid. Okay, so that's my long answer to a short question. Okay, so let me get to the other questions. Like I say, I can't, Shannon is saying I can't take desiccated thyroid. Well, some people can. Some people can't. And everybody's different. So, like, look at your fingerprint. There's nobody in the universe that's got your fingerprint, just you. There's nobody that's got your DNA. They got some of it, but we each got our own fingerprint and our own DNA. And this is why, like, again, I emphasize this, that a lot of times in medicine, the problem is that everybody gets lumped in together. So, if your thyroid numbers are normal, never mind your symptoms. A lot of physicians just, you're normal. But like I said yesterday, if you walks like a duck and talks like a duck and you got thyroid symptoms, losing your hair, gaining weight, you don't feel good, a lot of those things are thyroid symptoms. And, if those are the case, then it's not going to hurt you to stimulate your thyroid even more. You want your thyroid to work at its optimal level, okay? So, and I won't mention last names here. I'll just go first names. Connie says, I have been taking insulin formula. Okay, me too. I take it every day. And have tried the thyroid cream, thyroid hormonal cream and supplements, cortisol for a year. No results. Even done intermittent fasting. So trying insulin balance, my last resort. Total confused what to do. Well, Connie, listen. Again, okay? I talk to, in a year, probably tens of thousands of patients, okay? And you're an individual, and you've tried, and you're doing intermittent, you're doing everything. That's right. I mean, one thing, and Connie, I don't know. Maybe you've done this, maybe you haven't. The first thing that I would do, if you haven't had results, you're not feeling good, I would do the 4-week reset. I find that is 99% of the people that do the reset, no matter what their condition is, feel better. They get improvement. I'm telling you, we probably in January had over 5,000 people do the reset. And, it's never easy to do something like eat eggs, meat, and cheese only for 4 weeks. But I'm telling you, it's unbelievable. Like, you can implement, and you already did the intermittent fasting and all that. Look at, obviously, Connie, your body is in what, like if you haven't taken our teaching on the metabolic storm, you can get that teaching. It's unbelievable. You're probably in a category 5, meaning that everything that you own in your body is messed up. Your ovaries, your thyroid, your adrenals, your insulin, it's all messed up. And what happened to you probably took years to happen. And you, like you say, you're frustrated. You've tried everything. Well, don't stop, because first of all, you're on the right track, because look, you are what you eat. And I find that this is why I created the reset, is because there are, 88% of the population have trouble with their metabolism. 88%. 12% are normal. 12. That comes from the World Health Organization, not from Dr. Martin. That comes from them. Like, people are so metabolically challenged today. And yesterday and the day before, I was talking about chronic fatigue syndrome, or I like it better, sort of renamed it adrenal gland exhaustion. Connie, that's probably you. There's no shortcuts. There's nothing easy, but I would never give up. I would never give up, because your body, you might not sense that you're better, but if you do what I tell you to do, I can prove it to people. I've proven it to thousands and thousands over the years. When you change your diet, when you take probiotics, when you stimulate your thyroid gland, when you get your cortisol at the right level, Your body responds to that. You might symptom-wise feel, I feel, and I talk to people every day that are discouraged. And look, it's a journey. It's never easy. And I'm on your side. I'm 100% behind my patients, 100%. I always tell them, I got your back. This is a journey. Your body didn't get there overnight, and it's not going. And for some people it's dramatic. They feel better. If you're a diabetic and you go on the reset, all of a sudden it doesn't take long. It's food. It's food. If you're a diabetic, you have an allergy. It's allergy to carbs. It's not complicated. Your pancreas is not working properly. You have a condition called insulin resistance. You must fix that. That's a diabetic, but that's everybody else in a metabolic storm. If your thyroid's not working properly, you need to eat properly. If your hormones are not working properly, you need to eat properly. I'm telling you. And we live in a day and age where we're carboholics. We don't even realize how much sugar we are consuming. And if you have any kind of bread, any kind of noodle, you're consuming. Look, a carb is going to be sugar in 5 seconds. I don't care what kind of carb it is. It's going to turn to sugar rapidly. And when you're metabolically challenged, you can feel sorry for yourself because you're metabolically challenged. But I look at it the other way. Take it as, you know what? I'm bound and determined. This is where my 3 Ds come in. Desire to get better, determination to get better, and discipline to get better. It's not easy. It's simple, but not easy. And, I'm not a complicated guy, so I don't, look, the body's complicated. But I try, my job is to take the complication out and focus on what you can control. One of the things you can control, Connie, and others listening today, what goes into that mouth every day. And it's hard. We live in a carb world. We live in everything in the grocery store. I'm writing a book and I'm talking about there's 2 kingdoms, okay? Major kingdoms. I call it kingdom eating. God's kingdom, what did he give you? Animal and plants, right? And then there's man's kingdom. He took man-made food. There's man-made food. Like even bread, because bread isn't what it was 100 years ago. Why? They changed the flour. It's no longer stone ground milled. It's processed. Everything that man makes in food is processed, including using vegetable oils. It started with Crisco. You remember Crisco? That's vegetable oil. They replaced butter with margarine and Crisco. And that's man-made food. And I talk about that we got to get back to eating from God's kingdom. And what I do on the reset, I only let you eat animal, eggs, meat, cheese. There's a reason I do it. And so I'm just encouraging you. It's frustrating. I get it. I understand that. I've been doing practice. In May, it will be 46 years I've been in practice. I mean, I've seen hundreds of thousands of patients over the years, hundreds of thousands. And it's not easy. And I look at myself more as a coach. When people put their trust in me, then I coach them. And this is why our team is there at the Martin Clinic, because we want to coach you. We want to give you information. We want to help you. We want to push you. We want to coach you. Because, modern medicine, God bless them. But, they're so busy. They're so they don't even talk about food anymore. They don't do it. So, anyway, okay, long answer, but I just wanted to tell you not to give up. Deanie, my husband is told to stay out of the sun because he had melanoma on his belly years ago maybe 30 years ago when he worked in the fields, no shirt on. And last year on top of his head, on the size of a toonie. Plus right now got all kinds of spots on his head. Any suggestion? Well, look, so that I don't throw anybody off, okay? The vast majority, 95%, and this is fact, so you can come after me afterwards if you want. I don't care. I don't. Look, I want you to think. I don't want you to be a robot. I want you folks I'm giving you information. You take with that. Information gives you power, gives you choices, doesn't it? Look, I come at things from a different point of view. You guys know me, so this is what I do. But the sun is not the boogeyman. The vast majority of cancers that people get, skin cancer, are basal cell, are squamous cell carcinoma. That's burning in the sun. Melanoma is an indoor cancer. The vast majority of people that get melanoma don't get it from the sun. They get it from a lack of sun. And I have been preaching this for so long. I have been telling you, you need the sun. Now look, I'm not telling your husband who has had melanoma, go out and burn in the sun. I tell you that if he can't get in the sun, he needs vitamin D, because every cell in your body needs vitamin D. Vitamin D is, I told you the other day, it's a natural vaccine for everything. Name me a condition, I'll tell you, you need vitamin D for it. Everything. I can't think of anything that vitamin D doesn't help. So if you can't get in the sun, you need vitamin D. It's like probiotics. Everybody needs probiotics. If you're not on a probiotic, you're not doing everything you need to do. And so vitamin D is the same thing. Like, I'm going to get outside today because I'm in solitary confinement. They let me out so I can go for a walk. Some people, that bothers them. Well, isolation doesn't mean that you can't get outside. And if the government ever tells you that, it may be coming, but that would be the craziest thing I've ever heard in my life. You need to get outside. The sun is out today. Now, I'm not going to be able to get too much vitamin D because I live in Northern Ontario and it's still cold. I'm not going to be in a bathing suit today like those people in Florida. So look, if your husband can't get in the sun, then give him vitamin D. He should be on about 10,000 IUs every day. The higher your vitamin D levels are in your plasma, the less risk you have of every type of cancer. That's facts. All cause mortality, vitamin D. I'll preach it and preach it and preach it. As long as God gives me breath, I will preach on vitamin D. It's more important than vitamin C, and I know vitamin C has been getting some ink, and good for that. Like, Dr. Martin's vitamin C is coffee. But vitamin C, and the problem with vitamin C, let me just tell you a couple of things. One, vitamin C only stays in your body 3 to 4 hours. But if you can get it intravenously, this is what they're doing in some of the hospitals in New York. It was in the New York Post and a couple of others. Good for them. They're giving it intravenously. That's what I like about vitamin C. Because just taking vitamin C on its own, I just found it doesn't stay in your body long enough. That's Dr. Martin. So people have been asking me a lot about vitamin C. Well, look, I'll tell you what's better than vitamin C for the COVID-19 is vitamin D. What they're not talking about is giving although there was a study out yesterday that showed, I think I saved it. Let me get to it. I think I did save it last night. Hold on. I read this last night that, let me just see if I saved it here. I'm going to go on I got my tablet out if you're wondering what I'm looking at. Okay, let me just see. I think I did save it. Hold on. Let me read it to you. Former CDC, so that's the Center for Disease Control, Dr. Tom Frieden, F-R-I-E-D-E-N, Dr. Tom Frieden. Here's what he said yesterday. Coronavirus infection risk may be reduced with vitamin D. That was in the news yesterday. Now, you might not have seen it. I saw it. The former chief of the CDC says, take vitamin D. Isn't that incredible? Isn't that incredible? So there you go. And then, okay, just underneath it, I saved this yesterday. Okay, from a Dr. Stillman. The sun reduces all cause mortality. Why should anyone believe, okay, he's talking about sunscreen, but let me just read what he said. Why should anyone believe sunscreen would reduce all cause mortality? The data is not there. To this doctor, sun care means taking care to get sun on your skin and in your eye. I believe that too, by the way. Don't get about 20 minutes of sun without sunglasses, then put your sunglasses on. Unless you got some kind of condition, you can't. But try and, even your eyes need vitamin D. Isn't that incredible? Dr. Stillman, coming from him, MD. I'm not the only guy, Okay, let me get back to some of the questions, okay? So thanks for the questions. They've been really, really good. Okay, so now I'll get back. And Carla's asking about blood pressure. Okay, what's the right blood pressure? Well, you can Google that. Generally, 120 over 80. Now, again, what are numbers? I get people, all of their life, they've had higher blood pressure. It's been part of their life. Now, here's Dr. Martin, okay? Here's where I come from. The top number, look, I'm not saying it's not important. I'm just saying it's less important. You want the bottom number, in my opinion, never to go over 90. I never tell a person they have hypertension, high blood pressure, if it's not over 90, second number. They might have 150 over 80. And I tell them, look, I'd like that 150 to come down. Change your diet. It gets better. Because one of the issues, the main issue with high blood pressure is kidneys. And kidneys get under stress. You know why? Sugar, carbs. That's why on the reset, people couldn't get over. One of the first things that happen is their blood pressure gets better. So the second number is the most important number. If it is over 90, you got hypertension. That's dangerous for strokes, heart attacks. But you can lower it with food. And some need to take magnesium too, to lower your blood pressure. But where is that? What's magnesium doing? Magnesium is helping your kidneys, relaxing the blood vessels. And another thing with blood pressure, a lot of people are dehydrated. They don't drink enough water. Oh, Dr. Martin, if I drink too much water, I got to go for a pee. Well, go for a pee. So what? You're getting rid of all your toxins. Pretend you're a dog. When you see a fire hydrant, pee. No, but seriously, a lot of people they got thick blood. It elevates their blood pressure, and just by drinking water, they get their blood pressure down. And you know who's the most stubborn with water? Men. Huh, Doc? I don't like water. I know you don't. You're a big baby because you're a man. If I tell a woman to start drinking water, they do it every time. Men, meh. Oh, I drink coffee and my coffee is 95% water. Yeah, but it doesn't get it. Your coffee has to be filtered through your system. Water goes directly to your bloodstream. It don't pass go. It's like Monopoly. Seriously, the vast majority of people I test in my office are dehydrated. They don't even know it. They have very thick blood, the viscosity of their blood. And that puts an enormous amount of pressure on your blood vessels and on your heart and on your kidneys. Drink water. This morning, I would not allow myself vitamin C, coffee, without having a half a liter of water. I start my day 7 days a week with a half a liter of water every time, every day. And what you drank yesterday ain't going to help today. Every day, drink water. I mean, it's vitamin W on the Martin Clinic alphabet. Water. H2O. What's the best water? Mineral water. Why? It has electrolytes. It has minerals. If you're drinking filtered water from your fridge or whatever, that's all right too. Add a little bit of Himalayan salt. So now you have mineral water. But you need water. If you're drinking it from the tap, filter it. Get all the chemicals out. Put it in a Brita or whatever other those little inexpensive. Look, you can have a better filtration. If you got money, spend money. If you don't have money, then drink water out of your tap. Just make sure you put it in a Brita or whatever, filter it. What do they call it? There's another machine there, a new one. I like it too. Like, it's not expensive. Drink water. You need water. I'm telling you. It's amazing. I've had people, seriously, come into my office, migraines, years and years and years of migraines. I said, well, you're dehydrated. Oh, doc, I drink juice, I drink smoothies, I drink coffee, I drink tea. I said, I didn't ask you if you were drinking those things. I asked you how much water you're drinking. Well, I don't like water. I gotta put flavoring in it. Well, that's not. The second you flavor it, look, you can flavor it with lemon. Okay? Put a little lime or whatever. I don't care about that. But don't put anything artificial that turns the color of it. It's not water anymore. It will not hydrate you. Water. Suck it up, buttercup. You can do it. I've had, like I said, dehydrated. I said, start drinking water. Okay. Never had another migraine since. You cleaned your kidneys out. Helps to clean your liver. Why spend a lot of money when you can drink water? Okay, that's a good question. What, did I answer it? Yeah, blood pressure. How do you make progesterone? Well, your organs, remember, the orchestra leader in the brain, you got two centers in the brain. Let's see if you remember. Tell me what your two centers in the brain are. What about sparkling water? Sparkling water, but look, you're not going to be hydrated as much because sparkling water is more acidic. Sparkling water is, it's carbonated. I like it. I like Perrier. I call it my Christian beer. Okay? I drink Perrier. I love it. But that doesn't replace my 2 liters of water that I drink during the day. Okay? I just like it. I just drink. It's all right. It's not bad for you, but it's not water. In a way, it's not. It's carbonated. It's more acidic. Okay, that's what it does. So, I like it. Jean and Connie and Sari, you got it. It is the hippocampus, memory, hypothalamus, hormones. So how do you make progesterone? Your hypothalamus tells your ovaries to make progesterone. If you don't have any ovaries left because you had a hysterectomy, a total hysterectomy, your body has plan B, ladies. You'll still make, and you know what? Men make some progesterone too, a little bit. Pro-gestation, pro-baby. But remember, progesterone is very important. Why? Because really, ladies, estrogen is not your master hormone. Progesterone is. All your hormones are made of progesterone. You can't even make estrogen without progesterone. This is why I'm big on progesterone. I love progesterone. For women, you need progesterone. You need it for your bones. You need it for your skin. You need it for your hair. You need it for everything you can think of is progesterone. I'm a big guy. How do you make it? Your body makes it. When you get older, you don't make as much. And that's all right, as long as you're balanced. But a lot of women benefit from what we call bioidentical hormones. Hormonal therapy, natural, plant-based progesterone. It's in nature. So that's how you make it. And women need it. Yeah. Osteoporosis in women is, it's calcium. No, it's not. My doctor told me to take calcium. your doctor is wrong. Your doctor's wrong. Because calcium, when you take it as a supplement, don't even go to your bones. It stays in your bloodstream. Okay? So, what do you want to do? What do you want to take? Progesterone, ladies. That's important. And vitamin D, of course, for your bones. And water. Even water helps your bones. So guys, listen. Look, I'm going to, you've asked me a lot of questions. I'm gone over time here today. I've got a few more to answer here. I'm going to do that, okay? I'm going to do that on Monday. We're going to do, unless I got another topic I want to hit. Otherwise, I'll go into the private group and answer these questions too, okay? So this is more in the general group. If you're not a member of our private Facebook group, please join in. It's what a wonderful group it is, and so many people. The questions are great, and our staff is fabulous for answering your questions. So, guys, I love you guys. Okay, so I'm going to try and continue on with question and answer. Look, I'm in 2 weeks solitary confinement. I'm just finishing up my first week. I got another. You got me every day. Okay. I don't know. I might even do it tomorrow. I put your hands up if you want to hear something tomorrow. You know what? I don't even know what day it is anymore. There's no more weekends. Every day is a weekend. Someone said, how are you doing in solitary confinement? Well, I said, I don't know. What's everybody doing? We're all in solitary confinement. I mean, the only thing I'm missing right now is I can't go to the grocery store. Oh, I can't have my grandchildren come in my house. Now that's frustrating. That's frustrating. But nobody's doing anything, are we? Where can you go? I mean, other than go for a walk, right? And make sure you wash your hands and do social distancing. Okay? Guys, love you guys. Talk to you soon.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.